Hello, and welcome to this GIS Health feature. Today, we will be taking a look at the territory's partnership with Baptist Health International. Reporting for the Ministry of Health and Social Development, I am Public Health Communications Specialist Natasha Letzum. Government has been working with Baptist Health International since 2013. They have assisted the BVI Health Service Authority in expanding and improving healthcare service, quality, and patient safety. They were also instrumental in the transition from Peebles, the old Peebles Hospital, to the new one. Today we have with us Dr. Laura Hart, the Assistant Vice President of International Market Analysis and Development for Baptist Health International, to share more on the nature of the relationship between Baptist Health and the territory, and how this collaboration has benefited and will continue to benefit the Health Services Authority, the National Health Insurance, and the people of the territory. Thank you for coming on the program today, Dr. Hart. Now, to get us started, tell us exactly who is Baptist Health?
Well, Baptist Health South Florida is a large healthcare system based in South Florida, based in Miami-Dade County, with operations in 3 counties, Monroe County, Broward County, and Miami-Dade County. We actually have a wonderful video that perhaps you would like to see that highlights some of our centers of excellence and our facilities. So let's take a look at it. So as you see, we have 7 hospitals. Within our system, we have over 1,700 certified beds. We have more than 30 outpatient centers. And we also have several centers of excellence in cardiovascular, oncology, neurology, breast health. where we really focus a lot of our efforts. We have a lot of eminent physicians. We have more than 2,300 physicians who work within our network who are able to provide services. Baptist Health International is a group within Baptist Health South Florida, and we're dedicated solely to international patients and supporting international healthcare services organizations outside the United States.
Wonderful. Thank you for that great intro. Now explain to us a little bit about the relationship that Baptists have with the government of the Virgin Islands.
You know, that's interesting. We've had this relationship for nearly 15 years.
Wow.
We signed the first affiliation agreement in 2001, and what that did is that brought us closer together with the government as well as the people of the British Virgin Islands. And through that, we've been able to facilitate healthcare services provision to residents of BVI. We got even closer in 2013 when we started working with representatives from the hospital and the ministry to help with the transition and some human resource management support.
Now, as you alluded to, talk a bit about the support you have given to not only the government but to the Health Services Authority from 2013 to now.
Perfect. You know, we really feel like we've built a great partnership with people from all aspects of the healthcare services delivery system, whether it's the ministry, the Health Services Authority, or the people at Peebles. Fabulous people. We've had such a great time. So what happened is when construction finished on the hospital, we started coming over. And we helped with a lot of environment of care, which is really taking a look at the physical plant, the facilities, to making sure everything that could be done for patient safety and health services quality was taken care of to provide the best services here on island that you could possibly provide. And that we call environment of care. That was our environment of care assessment, where our experts in site development and building our new facilities and maintaining them and keeping them up to standard in the United States came over and actually worked hand in hand with the people from Peebles, going through room by room, wall by wall, piece of equipment by piece of equipment to identify things that needed some upgrade or changing. And then we worked to come up with transition plans, again, wall by wall, quarter by quarter, equipment by equipment, to put in place those things that really needed to happen to ensure patient safety.
Now let's go a little bit more in depth. In terms of the construction management, how was Baptist Health instrumental in that aspect of operation?
You know, as far as construction's concerned, we came in after the majority of the construction was done. So I would say our role was finishing touches. So the main part was completed. And when we came in, it was really fine-tuning things to get things ready for the new equipment that would be ordered and brought in, for the transition from the old facility to the new facility, again, to make sure everything was move-ready. But the bones were done.
No, the transition, that sounds awfully complicated to try to move people who are existing in the hospital and all the equipment and all the services and transition them to a new one. What are some of the things that you had to do in order to get that process done effectively?
So how did we do that?
Yes.
I think the short answer is very carefully. We had a great team. The team here, and we had a fabulous team back in South Florida. As I mentioned, we have 7 hospitals. Some are brand new, some were acquired into the system. So we have an awful lot of experience building a brand new facility from scratch, starting up a new hospital. Our West Kendall Baptist Hospital is about 4 years old. And so a lot of those people were really, really, really integrally involved in the planning. We also transitioned another hospital. We have a brand new hospital in Homestead, a little bit older than West Kendall, and that moved from an existing hospital where we transitioned patients and equipment and operations 3 miles. So there were ambulance trains and things like that. So what we did back home is we would have almost war sessions, planning sessions, where we would bring 20, 30 people into a conference room with sticky notes and sheets, and we'd brainstorm. Okay, so if you're in the emergency department, what's essential for us to make sure the people at Peebles know? And so we'd do all that planning. We'd work with the people at Peebles. A lot of people came over. 14, 15 people came over from Baptist Health South Florida, nurses, biomedical, safety, clinical, non-clinical people came over and worked side by side. And then we had nearly 20 Peebles staff come to South Florida for week-long observerships where they worked side by side with people from our organization. We shared move plans, matrices, project checklists, emails flew back and forth. They still do. Conference calls 2, 3, 4 times a week as we got closer and closer to the transition. But one of the most interesting things that happened were mock patient scenarios where a nurse would get in a bed and pretend to be a patient with a particular issue. This is prior to the plan, where there would be nurses and other people from Peebles and Baptist figuring out how they would solve that problem. And so doing that, they could figure out where should the supplies go, where should the charts go, where should the nurses plan to walk, because you have to run through all of those things to figure out the critical paths to get things done. So you've heard the saying, it takes a village.
It does.
It took a couple countries to get this to happen. Yeah.
I think I appreciate that information that you just shared, and I think it's important that we understand the level of work and what it took to get from one hospital to another with all the amenities, and bearing in mind we have patients in the hospital.
Absolutely.
So it's awesome to hear you speak on what it took to have that happen. Did you meet any challenges along the way?
You know, it's interesting. The biggest challenge we had was logistical, the distance from South Florida to Tortola. I think the biggest challenge was just the time getting people back and forth, whether they were heading from here to South Florida to really see what we've done and sit down with our team there and getting from here. And I think also challenges of new equipment or supplies getting to the island. And I think you experience that in every day. A lot of people go off island to buy things. Right. So I don't see it, you know, we don't call them challenges. We develop what are called workarounds. So if we heard from a supplier that something might not be arriving on time, you just go to plan B. Part of what we think is very important is you always have the plan A, which is your outcome you want. Then you have a plan B, and then you have a plan C. So there's always something that you could just move into place. But it was just wonderful. Everybody pitched in. The enthusiasm on this side was amazing. Really, really exciting for, you know, again, the workarounds are important because you have to make people comfortable that if something doesn't go exactly according to plan, you know what to do, because that lowers patient anxiety, which helps with healthcare, right? So people get better faster if they're not nervous. And so the patients' families were involved in move day. They were told ahead of time what to expect. So say your mom had been in the hospital. You as the daughter would know the move is coming and what we wanted you to do as far as the move to help. So again, it took a whole community.
Nice, nice. How long did it take from start to finish?
For the actual day of the transition?
To transition the entire old Peebles Hospital into the new one?
1 day. There's still some things that haven't been transitioned because we're waiting for equipment to come. But no, it was completed very, very efficiently. Not one compromise to patient safety, not one disruption in patient care. It was incredibly smooth. Very, very smooth.
Wonderful. Thank you very much for that update. Now, in terms of quality processes, how are you working with Peebles Hospital to improve processes and services, perhaps training initiatives?
Oh, wonderful. So part of ensuring a successful transition is working much earlier in the process with communication. Communication is key, and then training. So we've had our clinical staff, our nurses, work with the nurse managers in each department to identify needs for training and education. And then we've worked with the Human Resources Department to make sure that those needs were communicated. We had our Director of Safety come and help work with safety training and education through the Peebles organization. So we have a combination of things. So it's on-site training here, where our nurses would come and just work side by side. And then we have the observerships. Observerships are typically week-long, where, say, one of your nurses would come to South Florida and actually work side by side with nurses in the unit that they would be representing here. And then we would share policies, procedures, best practices, so very hands-on. So not theoretical is our biggest focus was on hands-on learning, sharing of best practices. And like I said, WhatsApp messages, text messages, emails, they continue weekly, daily when something comes up.
Nice. So how do you think that the nurses, have doctors been on that rotation as well, or are you only looking at nurses?
No, we've had people from administration, finance, operations, all of the functions of the hospital are welcome to come and have come for the observerships. There's still a list of people who want to come that we're just trying to make a schedule for when things would be least disruptive here for them to be gone. But no, physicians as well come for observerships.
Okay, so how do you think that has uplifted the morale of the workers of Peebles Hospital as well as expanded their repertoire?
I think it's done wonders. I think both ways. So our people coming here have been able to bring a different perspective because, again, the people who come from Baptist Health South Florida may have worked in different hospitals. And even though we're one system with one culture and one set of core values, maybe some of the operational ways to operationally implement something might be a little bit different. So they bring a different perspective. In addition, when people from here go to one of our facilities, you know, they're being invested in, right? It's a career enhancement. It's a new way of looking at things. And so I think it's been great for morale. It also gives an information flow that they might not have had. They've made relationship connections that they can pull from. And from what I've seen, everybody who's gone wants to go again. And they've come back and said what a great experience it was. So we've had other requests.
Okay, wonderful. Now, in terms of quality, in terms of gap analysis, what is gap analysis and what interesting discoveries have you made as a result of the process, as a result of all these trainings and observerships? Where do you see gaps and what are we doing to shorten them?
Perfect. So in January, we performed a formal gap analysis for accreditation, which is just a snapshot in time. From that came a report where we looked at certain areas that could benefit from enhanced focus, whether that's a particular standardized training program, or if it's more observerships or more training that's more one-on-one and things like that. So we've identified there's still some facility environment of care gaps that need to be filled that the ministry is well aware of. Those require, you know, investment in infrastructure. There's still some equipment that needs to come to replace some of the existing equipment, which will bring up the standard of imaging and things like that. A lot of new nurses were brought into the system because when you transition from the old style ward hospital to semi-private rooms, obviously the nurses and the clinical support can't see all the patients like they used to be able to see them. So a lot of nurses came in and nurse assistants. So there's culture training, there's standardizing the way people do things. And then there are some improvements that could be made, say with medication management, in the laboratory. All these things have strategic plans, and they have processes that need to be put into place according to a timeline that's been set. So we'll continue working on that, again, sharing best practices and policies and procedures. So the gap analysis was specifically focused on accreditation. But it's important to note that accreditation is really an external body's validation of the quality you've already achieved. So it's a journey. So every day, the Peebles staff and the HSA and the ministry are working on improving quality, patient safety, healthcare delivery, customer service. And so that's something that happens every day.
And definitely since the transition, I have seen improvements in quality and customer service. And I've also seen a boost in the morale of the employees as well, which contributes to better health care for everybody.
Absolutely.
So we've definitely been seeing the change.
Oh, that's fabulous.
Yeah, since the move to the new Peebles Hospital. Speak a little bit more about the environment of care, though. You spoke a little bit about that. Go a bit deeper.
Sure. Environment of care is it's taking a look at all the facilities, all the infrastructure, with the aim of identifying all the things necessary for life safety and patient safety. Because patient safety is the #1 concern. We all want to be treated nicely, but we want to make sure that's done with our care and safety in mind. So environment of care is a very important aspect of healthcare service delivery, where you need to make sure that all of the facilities and the infrastructure best support patient safety. That includes having what the clinical team needs in the right location, at the right time, in the right condition. And it's everything to do with upkeep of the facility. So that was really our first look when we started working more recently on the transition, was environment of care, because you can't move a patient into a facility when the facilities are not where they need to be. So that had to be done before the patients could be transitioned.
Okay, so how are we with the environment of care?
Oh, doing very well. We would not have been as enthusiastic about the move date had not the critical environment of care gaps been filled. There's still work to be done. There is every day. If you look at your own home, right, you see things, one day I'll get to this,
right.
But it's nothing related to your safety. And so that's the same thing. There still are improvements to be made, but there's nothing that would, inherently compromise patient safety.
Okay, that's great to know. Now, as we look to continue expanding our services and improving healthcare for the people of the territory, where do you see room for expansion?
Clinical training, nurse training, and all the people who support the healthcare. I know there's a big effort being made by the HSA and the ministry and the leadership staff at Peebles to continue to invest in training. It's a constant thing. You get one certification, it's time to start working either on recertification or another one. Same thing with training. You can never do enough training. And so, as I mentioned, a lot of new people have come into the system. And so there's a lot of training. There's orientation and then follow-up training. I think another area of huge opportunity is identifying centers of excellence. As I mentioned, Baptist Health South Florida has identified a handful of centers of excellence in, say, oncology or cardiovascular that best meet the needs of our community. And so we think it's very important, and we've spoken with a lot of people about identifying the centers of excellence that make the most sense for Tortola and the surrounding islands, for the British Virgin Islands, as well as the other islands that are maybe not part of BVI, but who could feed into your system. You have an amazing facility. You have fabulous people. And so to look at all of the healthcare needs and decide, okay, we're going to focus on, I bring up oncology, because you send a lot of people off island for that. What could we do to help keep people in their homes, help them get better faster, and that are things well within your capability to do? So I think centers of excellence is important. Training is very, very important. And then support with accreditation. Because when you do get accredited by an international body, that helps you bring more patients from other countries here for care. And that will help your budgetary situation.
Well, definitely. I know another conversation that's been going on is the talk of telemedicine.
Oh, absolutely.
Tell us a bit about what telemedicine is and if the BVI is ready for something like that.
Oh, perfect. Telemedicine is fabulous. You are a relatively small territory, right, with a population that may not support all of the specialists that you would like to have, because there's not enough demand. Right. With telemedicine, which, by the way, you're more than ready for, more than capable of, telemedicine, for example, you could tap into the Baptist Health South Florida physician network. Again, 2,300 physicians in our network who can do second medical opinions very easily. Electronically send medical records through your physician to our physician, to Dr. Viamonte, who you'll be chatting with soon. And then we can get a second medical opinion to validate a diagnosis that perhaps has been given by one of your physicians here. Or we can do tap into our emergency department back home, to our radiology department to read images, so you wouldn't have to perhaps have multiple radiologists working at one time. If you have a slow time of the day or night here, we could have people back in Florida read the images. And that's a really easy technology tunnel to set up. It's a click of a button. There's an image there. You get a report back very, very quickly. Another thing we have is a EICU, where we monitor ICU beds 24/7, 365 days a year, from a hub, a core in South Florida, with it staffed by intensivist nurses and intensivist physicians, and through cameras and diagnostics and medical screening, they can see what's happening with patients in different beds in different facilities. And that's something that you might want to look into down the road.
Oh, definitely. You know, one thing I've noticed here with the way they're conducting the clinics lately at the New Peebles Hospital is that there's a team. It seems like a team approach. I know one time I had to take my daughter to the hospital, and it was almost frightening to me when I saw about 6 of them in a it was about 6 doctors in a room. It comforted me that they had so many different opinions, but is that something that you've been working on with them in terms of this team approach as we venture into expanding and, you know, creating a more patient-friendly hospital?
Right. You know, we believe team is always a better view, particularly for diagnosis and determining a course of care. We have in all of our specialties, we'll do virtual grand rounds on a regular basis, or for oncology, we have a tumor board where specialists in oncology from different areas, whether it's surgical or radiology or the chemotherapy side or different things, they get together on a regular basis to discuss cases. And so they're coming from their own highly, highly, highly educated point of view, and they're able to share their perspectives. And so again, it's the concept of a village, bringing together different ideas to come up with the best course of treatment. And it's not just at the physician level, it's at the nurse level as well. So teamwork, we think, is very important. And in Baptist Health South Florida, the team is what succeeds or fails. It's not the individual. So that's just part of our whole core values.
Well, definitely. I really appreciate that team approach that I've been seeing at Peebles Hospital. It's very comforting, and, you know, it gives you a more feeling that, you know, everybody's in control, and, you know, with different opinions and hearing the different viewpoints, that, you know, you're comforted that there is a second opinion in the room. So definitely love that feature.
Good.
Now, we're soon coming to the end of the conversation. I want you to speak a little bit about how you're partnering with the territory as it relates to healthcare and insurance.
Sure. We signed a direct contract with the Ministry of Health, I think maybe 2 months ago. And what that does is that it solidifies a relationship, like I said, that we've had going on for nearly 15 years. There's one phone number to call. There's one email address to use to reach Baptist Health International. And then we can help with, like I said, making appointments, lodging, travel arrangements. It extended a discount off our pricing to residents of BVI working, you know, through your system. So if there's a patient referral, perhaps somebody goes to the hospital and the treatment they need is not available here at Peebles. So it's an easy referral mechanism through your entire health services authority back to Baptist Health International, and then we manage the system that we have in South Florida to make sure you get the best care at the lowest cost possible.
Why are these partnerships so important, especially for a small island nation like we are?
I'm going to go back to your size. What it does is it just grows your capabilities. It gives you access to services and a breadth of services that you would not otherwise have. And there would be no need to have. Again, we have 2,300 physicians, 1,700 beds, 16,000 employees, and you're part of that family. And that's a really important thing. So you don't feel that you're alone trying to figure things out. You're part of a huge network.
Well, Dr. Hart, we definitely appreciate you coming on the program today and sharing what I call a wealth of information with us as it relates to the partnerships that you've been having with the BVI and how it benefits Baptist Health, how it benefits individuals and us collectively as a territory. I leave you with this final opportunity to make any final remarks.
Well, thank you. It has been such a pleasure to be invited here to speak with you. And I think the final remark is we have had such a wonderful 15 years working with you, getting to know you guys all better in the past couple years. And it's just been incredibly rewarding. And we really feel that our organizations are so similar. We're family. The cultures are similar, the focus is similar, and we look forward to many more years continuing with the relationship.
Thank you again, Dr. Hart.
Thank you.
I want to thank my guest, Dr. Hart, for coming on the program today to shed some light on the important partnership that exists between the government of the Virgin Islands and Baptist Health International. I hope this program has brought to your awareness the considerable amount of work that has been going on behind the scenes as government continues to improve healthcare and healthcare services within the territory. Reporting for the Ministry of Health and Social Development, I am Public Health Communications Specialist Natasha Letzum. Peace and blessings.